Hi, my name is Paul Perko, and I'm an Associate Professor for Bioinformatics at the Department of Internal Medicine 4 at the Medical University of Innsbruck. As corresponding author, it is a pleasure to present you the key findings of our study on the identification of a novel therapeutic target in the area of chronic kidney disease.
This work was a joint effort between researchers from the Medical University of Innsbruck and the University of Michigan and was conducted within the framework of the EU-funded Beat-TKD project. So in nephrology, the majority of studies focuses in fact on damaging molecules being upregulated in the diseased state, and no comprehensive analysis of molecules with renoprotective potential has been conducted so far to the best of our knowledge. We have previously generated a set of proteins with renoprotective potential following the literature mining approach. Aim of the present study was to analyze this set of renoprotective factors and determine the association of gene expression with chronic kidney disease severity and outcome. The patient cohort from the Medical University of Innsbruck served as discovery cohort. Gene expression patterns were evaluated in this set of 63 CKD patients, for which median follow-up data of around 7 years were available. Progression was defined as either reaching end-stage renal disease or doubling of serum creatinine. 24 of the 63 CKD patients reached an end point during follow-up, with 39 patients showing a stable course of disease. In Kaplan-Meier time-to-event analysis, we identified 6 of the renoprotective factors being significantly associated with outcome, where lower gene expression levels were associated with worse outcome. For 5 of the 6 factors, evidence on the association with human CKD progression was available in scientific literature, turning our focus on the 6th renoprotective factor, namely D6R, decarbonyl and L-cellulose reductase. For D6R, no reports on the association with human CKD progression existed, and all further analyses were therefore focused on this factor. D6R was also significantly downregulated in CKD when investigating gene expression patterns in independent, publicly available transcriptomics datasets. The association of D6R with disease progression was validated in samples of the Neptune cohort. Neptune is a multi-center, multi-ethnic prospective cohort study of patients with nephrotic syndrome. Analyzing gene expression profiles from 225 Neptune patients led to the same findings that we obtained in the discovery cohort, namely that those patients with the lowest D6R levels had the worst prognosis, as can be seen in the Kaplan-Meier curve on the left. Expression of D6R is significantly higher in tubular interstitium as compared with the glomerular compartment, which is in line with protein antibody staining data from the Human Protein Atlas. Single-cell RNA sequencing data also show that D6R expression is restricted to S1, S2, and S3 tubular segments. Mechanistically, D6R is part of the formation of xylulose 5-phosphate pathway, where it reduces L-cellulose to xylitol. D6R, however, also shows strong associations with enzymes linked to decarbonyl stress detoxification, as shown on the right-hand side. This is also the proposed mechanism of its renoprotective potential, as decarbonyl compounds are precursors of advanced glycation end products and inducers of fibrosis, next to being upregulated in uremic patients. Glyoxylase 1 is another enzyme that degrades decarbonyl compounds, and the beneficial impact of GLO1 inducers on metabolic and vascular health has been recently shown in a clinical study. Interestingly, SGLT2 inhibitors significantly increase gene expression levels in human proximal tubular cells in vitro. This finding is in line with the recently published data where 2 human proximal tubular cell lines were stimulated with TGF-beta, and both canagliflozin and empagliflozin increased D6R levels up to 2.8-fold. So in summary, we could show that D6R, which is mainly expressed in renal proximal tubular cells, is significantly downregulated in CKD and also significantly associated with CKD outcome. D6R is mechanistically linked to decarbonyl stress detoxification and the SGLT2 inhibitors are capable of inducing D6R expression in human renal proximal tubular cells. I hope you enjoyed this presentation of our work. I would like to thank my colleagues at the Medical University of Innsbruck who contributed to this work, as well as all partners from the University of Michigan, in particular Wenjun Chu, who is shared first author of this work. I would also like to thank all PIs from the Nephrotic Syndrome Study Network, and as mentioned in the beginning, this work was conducted within the EU-funded IMI Beat DKD project.
If you're interested in further details of the study or potential collaborations, do not hesitate to contact me.